welcome to the level 4 visit. Okay, so this lecture is all about level 4 visits. You can use either time or medical decision making for this one, but like everything except for level 5 visits, I really prefer medical decision making because it's easier. You can get it done quicker and you can meet the requirements pretty simply by just doing your documentation appropriately. Okay, so let's see, for level 4 visit, an established patient, it's about 30 minutes. Okay, that's the requirement that you have to see, manage everything that patient for at least 30 minutes that day. To bill a level 4. For a new patient visit, it's 45 minutes. So it's quite a bit of time, right? You can get medical decision making done on a level 4 visit. You can document, you can meet all the qualifications and requirements for a level 4 visit in 10 to 12 minutes most of the time. Okay. So when it comes to all of the requirements for medical decision making, you need to meet 2 of those 3 columns, right? You need to meet requirements for 2 of the 3 columns of this chart. Okay, plain and simple, 2 of the 3 columns. For every time you think of medical decision making, it's got to be 2 of those 3 columns. Okay. So I always tell people for level 4, it's easiest to meet column 1 and column 3. Okay. Column 1 is the complexity problems addressed, and column 3 is the risk of complications column. Okay. To meet column 1, you need 2 plus stable chronic medical conditions. Think high blood pressure, diabetes, high blood pressure, hyperlipidemia, GERD, osteoporosis, these types of things. And then to meet column 3, you just need to do prescription drug management. It's a pretty big term, right? And so you can do a new prescription. You can say continue current prescriptions. You can say I'm going to change this one around. I'm going to increase the dose of this, whatever it may be, right? So that right there gets you a level 4 visit. So say somebody's coming in for their 6-month follow-up, right? Just kind of their standard run-of-the-mill 6-month follow-up. They have high blood pressure and diabetes. Okay, so you're going to check an A1C, blah, blah, blah. They're stable on their medicines, okay? So you have high blood pressure, diabetes, they're your 2 stable chronic illnesses. They're on metformin and Actos. So you say, oh, okay, great. Well, continue metformin, continue Actos. We'll check an A1C and see if we need to adjust medications. Boom, that's a level 4 visit. That won't take you very long at all. If you build that based on time, you'd be there forever, right? You'd be there forever doing those simple things like that. So that's why I say medical decision making, if the patient has no questions, and they're stable, they're happy, they're just coming in to make sure everything's going good, that their work looks well, the medical decision making is the way to go, right? It's the way to do it because you get done quicker and you don't have to justify your time. You just have to justify your documentation, which if you just use templates, your documentation will be done in minutes. So if you bill based on MDM, you can see a lot of patients every day. You can quickly bill it. The audits are simple. If you bill based on time, it gets tougher, right? Because there's only 24 hours in a day. There's only 8 hours in a work day in the clinic. So unless you can prove that you're spending a ton of time outside the clinic, you're at risk of failing an audit. With medical decision making, audits are easy to pass because it's based on your documentation. It really is. So when it comes to RVUs for level 4 visit, this is why everybody should be doing it, because number 1, it's very simple, and number 2, it's a really high RVU generator. Okay. 99214, an established patient visit, is 1.92 RVUs, and 99204, a new level 4 visit, is 2.6 RVUs. So compare that to the 1.3 RVUs for an established level 3 visit. You're getting 0.62 RVUs more for every visit for a level 4 versus level 3, right? Factor that in 20 times a day. That's quite a bit, right? That's at least 10 and 11 more RVUs a day when it comes to level 3 versus level 4. So if a patient has 2 different medications, right? They're on a diabetes medicine, they're on a blood pressure medicine, they're on a high cholesterol medicine. Just simply ask them how they're doing with it. Say, hey, how are you doing with that? Any muscle cramps with your statin? Did you know that PPIs can lead to malabsorption of B12? Those types of things. Check in on those problems, because then that becomes a chronic, stable medical condition that you can document on, right? They might not be there for that, but then you can document on that, and then you can build a level 4, because at the end of the day, let's be honest, at some point in the next few months after that visit, they're going to call and request a refill of that medicine. You're going to have to manage that medicine anyways. So you might as well manage it now and get the increased bump in RVUs for thinking about it than doing it for free later on when it comes to messages, refill requests, all that kind of stuff, right? So I'm not advocating for making up documentation. I'm advocating for being a complete family doctor that you are, reflecting that on paper in your charts and getting paid for it, right? Because at every visit, you're not just simply doing what they request. You're looking at their medicines, you're checking their blood pressure, you're seeing when they last had an A1C done, you're ordering those things, get paid for it. Plain and simple. You're doing it. If you even talk about it, bring it up. If they request a refill, anything like that, document it. and get paid for it. Plain and simple. It doesn't matter that it's easy to do it. What matters is that you're meeting the criteria. You went through all the training to do it. So get paid to do it. Don't commit fraud, right? Don't go through and put stuff in the chart that you didn't actually talk about. If you're going to put high blood pressure in the chart, then you better say to the patient, hey, your blood pressure looks great today. You doing okay with your medicines? Boom, high blood pressure, continue medicines. That's a diagnosis. That's prescription drug management. Hey, how's your diabetes been? Oh, my sugars have been 150 in the morning. Oh, okay. Well, maybe we ought to tighten things up a little bit. You're on these 2 pills, right? Yeah, okay. Well, let's maybe add a third or increase the dose on one of those. We can tighten that up a little bit. Boom, done. That's type 2 diabetes. Continue current prescription plus add this other one, right? That's being a good primary care physician, primary care provider. It's not fraud, right? It's being a good doctor, documenting it and getting paid for it. Okay. It doesn't matter that it's easy for you. You went through so much education and time to get here. It doesn't matter that it's easy now. It's easy now because you spent so much time learning your craft. So get paid for it, right? You never will get a plumber that says, well, today I fixed 2 toilets, but I think I'll just bill you for 1 toilet. No, that doesn't happen, right? Get paid what you're worth. Please get paid what you're worth. So anyways, that's a big, long rant. Level 4s are the majority of what you should be doing at most of your visits. It's very simple to get there. Don't feel bad if you bring up a medicine, you talk about another chronic problem, put it in your documentation, upcode it, and get billed for a level 4 visit, right? Bill them for a level 4 visit if you meet the criteria for it. Don't bill for a level 3 if you meet the criteria for level 4. Plain and simple. Okay, big, long rant. Thanks for watching. If you have any questions, feel free to reach out to me. And the next one's really simple, level 5 visits. We'll touch on that briefly. So see you next.